Hello, friends. My name is Dr. Murtaza Adeeb. I am an orthopedic surgeon and a joint replacement surgeon based in Pune. And today I will talk about how we actually do a total knee replacement. This is mainly by public demand. A lot of people ask me that, can you please explain what you actually do when you do the operation? It's very technical, but I'll try and keep it very simple. So basically, the first step of the operation is obviously anesthesia. So most knee replacements are done under regional anesthetic. That means that we just give them an injection in the back, which is called a spinal anesthetic, and that basically numbs both the legs for a period of approximately 2 to 2.5 hours, and that is enough time for us to do the operation. This is obviously done by our anesthetist friends. So this is the first step when the patient comes into theatre. Second step is we prepare the leg and the knee for surgery, and this is done by basically cleaning the leg with antiseptic fluid and then draping the leg with antiseptic sterile sheets. The surgeon, in the meantime, also cleans himself, and then we wear the operative gown and the gloves, etc. We usually put on the mask and the cap before we enter the theatre. So once the patient is prepared, the patient is positioned appropriately. So in a knee replacement, usually the patient is sleeping on the back with the knee kept in a flexed position. We use some supports for that as well. And now the first step of the operation is make the skin incision in the front of the knee. That is the first step. Second step is going through the layers, through the skin, the subcutaneous tissue, and then the capsule of the knee, and we enter the knee joint and we expose the knee joint. Once the knee joint is exposed properly, then we start the process of preparing the bone for the implants. And this is done if we are doing a robotic knee replacement, then I usually put in markers for the robotic machine and then map the whole knee for the robot to see what the knee looks like, and then instruct the robot to come in with the cuts of the bone. While doing a conventional total knee replacement, we then proceed with the bone cuts. These are done using specialized equipment. We basically use instruments to size the knee, and according to the size, then we start making the required cuts, bony cuts to the joint. In between, we also try and do the soft tissue releases. So soft tissue releases are very important, and this is done to balance the knee so that when we put the final implants, they fit in very snugly in all the ranges of movement. So in full bending and in full straightening of the knee. Once we prepared the bone, then we have certain trial implants which are the same size, the actual implants. So we then put these trial implants on and confirm that we've done all the correct cuts properly and also release the soft tissue appropriately. Once we've checked that with the trial implants, then we open the implants according to the size that we've already taken. And once we open the implants, then we take cement, which is called bone cement, and we use this as a grout. So we prepare the cement and then apply that to the implant and to the bone as well, and then fix the implants in. Once we fix the implants in, there are, as I mentioned earlier in my videos, there are three main implants when we do a knee replacement. One is the femoral implant, which is on the thigh bone. There is the tibial implant on the bone in the shin, and then we use a plastic insert in the middle, which is called the tibial insert. So once we do the cementation with the real implants, we use a trial plastic implant in between, and we wait for the cement to set with the leg in fully straight and full extension. Once the implants have set appropriately, the cement is hardened, then we take out the plastic implant and we make sure that that is the right size. We may do another trial, etc., with another size if we have to. And then we take the main implant, the main tibial insert implant, and then we insert that in. Once you've done that, we again check for stability, etc., and then we finally do the closure. Closure is done in layers. So first we close the capsule and the muscle around the knee, then we close the subcutaneous tissue, and then finally we close the skin incision. Once that is done, we make sure that we put a nice sterile bandage on it and some compression bandage over it as well. And then this is the way we finish the operation. This is, as I said, quite technical. I've tried to keep it as simple as possible. I hope you can understand this. If you have any further questions, feel free to contact my team. Thank you.